Hey, hey, here we go, here we go, here we go. I haven't done a live in actually quite some time, actually. Um, yeah, I mean, I would say the last time I hopped on and did a live video has probably been, I don't know, probably about 6 months ago. So I figured I needed to hop back in. I know this is very random hopping in on this Sunday morning. But yeah, I haven't done a live or haven't reached out to anybody in quite some time. Wanted to see how everybody was doing out there. Good morning, good morning. How you guys doing? Loving the comments already coming in. Chiropractors have the hottest wives. Thank you, thank you. What's going on, guys? Hi, Argentina. Where's everybody watching from? Where you guys viewing in from? Hey, hey. Good morning, guys. Good morning. So just so you guys know, I am doing this on my own. I sent my wife out with the kids, so I had a little bit of peace and quiet at the house. So I'm going to be trying to catch all the comments coming through. So, all righty. I'm seeing Dallas, Houston, Greenville. Hey, hey. Nice Greenville, Michigander over here. Same here. Kansas City, how you guys doing? Long Island, Charlotte, Denmark, Chicago in the building, Finland. Man, we are coming from all over. Crazy how YouTube brings people together. Still, I'll never get it. It'll never wrap around my head fully what everything with YouTube. But oh, Carlos, you're king. Thank you, Carlos, for that super chat. Man, but no, so actually this morning what I kinda wanted to reach out to you guys, I don't know if you guys noticed, but I've been posting just say a little bit more often than usual. I've been trying to get something out once a day for you guys. Um, I know everybody, I've always gotten comments before. They love to see more content, love to see more content. I know you guys have, I'm hoping you guys have been liking the consistency as I've been putting the videos out. I guess one of the main things that I actually want to reach out, I don't think I've really ever asked you guys that are watching all the time, but what kind of videos interest you guys the most? Like, what do you guys want to see more of? That's kind of, I figured I'd ask you guys, everyone who's watching, what do you want to see more of? Hey, good morning, Joel. What's going on, my man? All righty. So I am definitely gonna start reading some of these comments. On that note, everyone, fire away. Tell me things that you guys would want to see more of. Obviously, you guys see my videos, you see the types of patients that I have. Do you guys want to see, I guess, I don't know, more problematic type issues? Do you want to see me get a little bit deeper in some soft tissue work? Is there a specific genre? Is there anything in particular? Headaches, neck pain, low back pain, sciatic? Like, what are you guys wanting to see? Because I've got so many videos saved up, and obviously, every time I'm in the office, I'm probably filming at least about 10 patients each day. So, kind of want to get a note to figure out what I should watch out for and what I should make sure and get. Okay, so let's see. All right, more ASMR focused content. Okay. Me and Mama Sip doing a self cracking video. More long term treatments. Okay. All right, some of the videos where people walk in, can't really turn their heads, and some more crazier cases. Oh, Carlos, I see that. Me and Tubio tag team a client. Actually, I could probably get that. Tubio and I were boys. We graduated together over at Life University. So yeah, I can always hit up Tubio. Let's see. And extra cam would spice it. I was actually thinking about doing that, getting another camera and having like one view from here, one view, maybe even a top view going down. Yeah, I was thinking about doing that. Also, just to let you guys know, which I think you guys will appreciate, I am have recently gotten a instead of my wife and I doing all the editing ourselves, we're finally bringing somebody who does this, professionally. And so I'm hoping, well, I already know, but she's going to be able to clean up the sound quality in the videos. So I know the cracks now, because you get a lot of background noise from like air conditioning and things like that. So she's going to be obviously cleaning it up, kind of making the videos a little bit smoother in that sense. Um, but yeah, so at least quality wise and sound wise will definitely be improved. So I hope you guys will like that. Let's see here though. Yeah, thank you, Nanu. You are my idol. I watch all your videos. Well, thank you. Um, with the neck stretch and the strap. So obviously, okay, getting more Y straps in there. Someone seeing more girls. Chronic pain ones that haven't felt relief in years. I can definitely get a little bit more because you got to realize my patients that come in, people travel from all over. So it's content that's stacked up. I don't know really what to put out. It's kind of whatever my wife would just edit up for the time being. But we can kind of, now that I have somebody going to be doing that, I can have her focus on, if it's problematic, a little bit crazier cases, I can do that. Okay. Ooh, some more sport athletes, professional wrestlers. I can do that. I can definitely reach out. I know, especially right now with the like off season with the NFL, I can definitely, if you guys want me to reach out to some NFL players, we can get that going. All right, some TMJ relief. All right, some of the repeat and follow up clients. Okay, that I can do. So a lot of the times when I get a patient in the first visit, if they do the $200 option, I'll record that. Typically after, I normally don't unless it was like, a video that like really took off quite well. So that I can definitely look into and when patients come back in, I can definitely talk with them and have them, as long as they don't mind, we'll keep doing a follow-up because, you know, it's nice when you start seeing the progression. I do see where you guys are coming from with that. So I can keep that going with the progression of the videos. Let me see. Let me go through the list here. What else am I seeing? All right, the follow-up. All right, more long term. I wish I knew anybody in Hong Kong, but sorry, I do not actually. Tampa office. All right, so actually, just so everybody knows, Tampa is actually my home base now. I moved the family, I moved everybody out here. I'm 3 weeks in Tampa, 1 week in Greenville, South Carolina, and then I've got my Dr. Trey, who trained up, and he's been running the Atlanta office, and which people love him out there. I'm gonna get my Atlanta license soon, so then I'll hop in and I'll do, a little bit of when I'll still do the 3 weeks in Tampa, but I'll do like half a week in Atlanta, half a week in Greenville, just so I can kind of hit all three locations. Um, let's see. All right. Days in Tampa. Typically I'm doing Tuesday through Friday are my days in Tampa. Okay. How long is my wait list? Honestly, I purposely open up time slots like 2 weeks in advance just because my days would book out like crazy. Um, I remember at one point, I think I was 6 to 8 months completely booked out. So I'll purposely like book, just say like I work an 8-hour day. I'll purposely only book up 6 hours, and then like a week or 2 weeks before, I'll open up the last 2 hours just so it's like I get people who previously booked from so long ago and then newer people. It's just something I do. I know I probably should just have it open, but you can't really help when somebody gets an injury and you don't know if or when you were gonna need to come in or not. Oh, let me see. Carlos again. All right. What happened to the emotional life changing client videos? 9 million views. All right. So I'm going to imagine you guys are, Carlos, you're talking about the motorcycle accident patient. Um, Last I heard from him, he was actually doing extremely well. Um, I should reach out to him. It has been a couple months since I've reached out to him, but last I talked to him, he was doing really well. Um, a a ton of change with that adjustment. And the funny thing is, what most people don't realize, that video, I almost didn't even film him. So it was a day when I was at Greenville, South Carolina, and I was way behind on patients. I probably had a waiting room of like 15 people, and he came in, literally, he told me his entire story, told me everything going on, and I didn't have the camera going. And then when he went to lay down, that shuffle in his feet, he did that shuffle, and I was like, "Oh my gosh, man, I need to record this one." Like, holy cow. So I ended up, after it took him like, a minute to get down on the table, I was like, "Dude," I'm like, "You mind?" I'm like, I gotta film you. Let's turn on the camera. You cool with that?" And took him a few minutes to get him back up. But that's why in the beginning, when he's telling and sitting and talking about the story, he literally already just told me everything like up front, and now he was like having to like repeat everything again over to me. But yeah, he's been doing better, but I definitely will reach out to him, because I'm actually kind of intrigued to see where he's at and how he's doing and how much further we can get him, better and whatnot. Well, let's see, what else do we wanna hear? So I'm gonna go through. Alright, can I do some MMA fighters? Jaw and finger cracking, and also fetish cracks. So, yeah, I can definitely do some more jaw, fingers, toes. I can definitely get into that because I know I'll go through some of the videos, you'll see me do the hands, the wrists, the fingers, not all though, kinda patient specifically ask for it, I'll do those. But yeah, I can definitely kind of get it a little bit more ASMR with the cracking and whatnot. I can definitely do that for you guys. Okay, Carlos. All right, you pulled your lower back. Do you recommend adjustment? I would say if you pulled something first, give it a few days. Ice ice overheat is typically what I'll do if it's a more recent type injury. Uh, Kinda rest it. You don't wanna, like, re-aggravate something when you have an injury. Sit for a day or 2. Now, it depends on, your typically, if you're adjusted regularly, if you've never seen a chiropractor, I will always tell anybody, just getting aligned. It's not as much all the time. Like, I get 2 types of patients in my office. I get patients that are coming to me because they are in pain, and then I have patients that are coming to me because they're not in pain and they wanna stay out of pain. So, it just depends. If you're one of the people who you're not in pain, you just wanna stay aligned and stay out of pain, then, that I would definitely recommend going and seeing a chiro. If you're close enough to me, I would be happy to have you come on in. Let's see. All right. Would I come to New Zealand? You know, I know over there, just it depends on the different countries that you go to. There are different laws and rules and regulations. I'm not sure exactly what I would actually need to, like, submit, or I personally I've never even looked into it, but I could definitely look into doing some kind of like destination adjustment. Let's see. All right. Do I recommend anybody in the DC area? Off the top of my head, not off the top of my head, but I know for a fact I've been seeing somebody pop up on my Instagram, and I'm almost positive it's the like DC area. Um, Carlos, send me an email. Do it to Dr. Joseph Cipriano at gmail.com. I think I know somebody for you in the DC area. I really gotta, like, look in and just check to see if it's who I'm thinking of. But yeah, just send me an email and I'll gladly let you know that person in DC. Okay. How do I feel about YouTube videos that explain how dangerous a Y-strap is? People who have never used a Y-strap or never experienced, they have no idea. So the Y-strap has been around since the mid '80s. The Y-strap is safer than any chiropractic adjustment out there, because instead of doing a rotatory type adjustment where people are always worried about, the arteries in the neck, of basically ripping is what it is. So the Y strap is a straight, like, inferior to superior. It's just right along that Y axis, and it's a straight decompression. There's no twisting. There's nothing. The worst thing that could ever happen with the Y strap is a muscle sprain, strain, like ligament sprain, strain. Like, that's all. That's the worst thing that could happen with the Y strap. So people who have no idea about the Y strap and people who just think chiropractors do absolutely nothing, of course they're gonna try to, go at me, go at the Y strap, go at the ring dinger, go at any type of spinal decompression out there because they just have no idea. Okay. All right, MPDACNA. There's controversy over the motorcycle rider that you helped. How, or has he come back? Some say he passed away. No, to the best of my knowledge, he has not passed away. And yeah, I don't think that. I think I did catch a comment like that coming in at one point. No, as I know of, he did not pass away. I know he was doing, like, really good. I know after the adjustment, we were originally gonna have him come out to Tampa location because he's got family in Clearwater. Never set that up though, but yeah, we reached out one time, and I know he was doing really well. So I will definitely say I will reach out to him again because I can tell quite a few of you guys are kind of intrigued on that video and intrigued on, just, the results and how he's doing after. So I will definitely find a way to get him back in. That's for sure. Okay. All right. Are there any side effects after treatment? Honestly, with any adjustment, you can get a little bit of soreness. I'll always tell everybody after they get adjusted by me, especially that I'm a little bit more aggressive and a little bit more forceful. A lot of water, rest, relax, no lifting. If you're planning on, like, working out and things like that, just take that day off. Besides that, just some muscle ache, like just like a little soreness the day after. That's about all though. You're not really gonna have, like, pain after getting a chiropractic adjustment. Or, I mean, you shouldn't have, like, serious pain after a chiropractic adjustment. All right, I'm seeing over here. All right, Brent, how do you determine whether to use a chin strap or not before performing the Y strap? So honestly, when it comes to that chin strap, that little attachment, honestly, I feel there's really no say. It doesn't really matter on either if you use it or if you don't. Some people, and you get some people where their occiput and their the EOP, there's a little spot in the back of the occiput. Um, it's a bony landmark, and just depending on how the patient's neck and head are, so you get some people where they have a really wide neck and the strap doesn't want to hold really well, it'll slide all the way up. Or you get some people that, just like very thin and it can attach really well. So there's really, honestly, it's really a preference of the doc. I just feel at times I get a little bit better hold with having that chin strap on. Now it's not, some of my long-term patients that have had the Y strap before I was using more of the chin strap, they like it with no chin strap, but it yeah, there's really no difference with it on or off. Okay, let's go through. All right. Oh, it would be awesome if I did a live with him. I would definitely have to reach out and see. The only reason that I don't like doing live chiropractic videos is because there's, like, right now I'm doing this just on my laptop, and when I have the camera, I have that external microphone on it, so it can actually pick up sounds better. So that's the only reason why I haven't really done a live chiropractic adjustment. Okay. Y strap versus inversion table. Inversion table, a lot of the times, inversion tables are really good for lower back. Um, Only kicker is you're not going to get much relief past the lower back on an inversion table, where the Y strap is going to decompress the entire spine from cervical going all the way down to the sacrum. Okay. And Camille Wallace, thank you. Best regards from Poland. Thank you. Glad to have that super chat. Thank you. Let me know if you got any questions or anything. Right now, what I'm trying to figure out from everybody is what type of videos or what do you guys want to see me do? If there's certain patients, certain ailments that people have that you want to see, if there's certain adjustments you want to see me do, if you want to see me get into more therapy, soft tissue work, if you want to see more patients with headaches or sciatica or jaw, just let me know and I can go through because I've got a ton of videos that need to be edited still, and I can kind of pick and choose a little bit. So that's kind of what I'm trying to figure out. And I'm going through the comments and trying to find things and you know get questions answered. All right, let me see. Can I come to Australia to give you an adjustment? I would definitely, to be honest, I've never been to Australia and I've been asked about like traveling, to a certain area. I do got to just look into the laws and the rules and just have to see what I need to do to be able to adjust in those areas. And once I do that, then every now and then I wouldn't mind if it's like a once a year trip going somewhere and doing like a destination would be actually kind of cool. Videos with me and my hot wife. Well, thank you. Wifey right now is, gosh, what is she? We've got she's 6 months pregnant right now. She's got a little bit of a belly going on her. She's due in June. So I might do another video with my wife. It'll be a pregnancy chiropractic adjustment video. If you guys did want to see that, because when I have a patient, especially where she is, how far along she is, she's not able to lay face down, obviously because of the belly. So I kind of have to change up. It's a lot more sitting, standing, or laying on the back or the side. So I can definitely do a video with my wife, that's for sure. All right. Again, all right, create playlist and lose the hyped all cap titles. You don't need it and they look hokey. you know, it's funny. Well, I do have some create playlists, but I feel like I haven't actually kept up with doing it, and I should probably create playlists like I already saw Joel on here earlier. I don't know if he's still watching, but like different patients with the hyperkyphosis or like certain scoliosis patients, but keeping it in an order so you can see like that person and have like all those videos to that person, like Bottle Girl, and have all the videos to Bottle Girl or like my wife and all of the ones of my wife. So I can definitely do that and change the playlist up a little bit and move things around like that. It'll probably be easier to follow, like if there's certain people that you like seeing. Carlos, congratulations. Thank you. Yep, we got a little baby boy coming in end of June. So that'll be number 3, which now the children are taking over. There's 3 children to 2 adults, so I don't know, not ready for that yet. Tim son's birthday, June 22nd. Yeah, that is gonna be right around where my son is, right about that same time. Let's see. All right. Oh, love the guy who couldn't move his neck for 15 years. Yes, he such a nice guy. Him and his mom come in. I would say usually every month to about every other month, and yeah, it's crazy to know where he was at, where he started. It's been helping him a ton. Just his day-to-day pains have been lessening, so I'm just glad. But yeah, I can definitely get a playlist set up with just him and Ed, so it's easy to follow and track his progress with everything. And Carlos, again, thank you for the super chat. Yes, I do adjustment on my kids. It's funny though, my kids, well, they won't let me do a full thing. I'll like get one and my son will be like, Papa, no more cracking. No more cracking, Papa. I'm good. But it's funny. And then if I'm ever like laying, just say like on my stomach on the couch, my son will jump up to me and try to like, try to crack my back and be like, "All right, Papa, I got you, I got you. All right, flip, flip," and he'll grab my head. It's kind of funny. It's funny. He's kind of understanding what I do, and it is funny watching him now. Let's see. All right. Do I or can I still do leg pulls if somebody I can't talk this morning. Previously tore their ACL. Um, I mean, if it was something previously done and they got fixed and repaired, completely fine. But if it's still, I mean, if there's still a tear in there, I might do enough where I just get the ankle and not try to get the full leg pull. Let's see. All right. Ian, how are you doing? Thank you for the super chat. All right. I need slash want to be adjusted by you, but I am in California. Well, man, yeah, I know. I'm not out there at all. I'm like completely opposite other side of you. Uh for Tampa, Greenville, and Atlanta. There now I'm not sure if what part of California you are in, but I do have a good buddy of mine that is moving out to there. And I know it's not me, but he's also a great adjuster as well. Um yeah, you could definitely get adjusted by him. That wouldn't be bad. That would be at least, be second best, very comparable in that, especially with travel wise. So let me know if you need his contact. Send me an email at dr and then my name, Joseph Cipriano at gmail.com. I'll send that to you. Hey, Optimus, how you doing? How you doing? Yeah, I need to step up my game. What's going on? Man, it's been a while. It's funny. I would always get those comments like, "Man, where's Optimus with timestamps?" And yeah, you do need to step up your game. I feel, you're slacking a little bit. Everyone used to always get every timestamp of every video coming out. But yeah, so everyone, if you remember, this was probably, gosh, Optimus, what was this? Probably 2 years ago at least. Right here. He was always like the first one, always putting the timestamps of every crack. And yeah, your people definitely love that. Now I feel like I can go through in my description and I think I can list out and I can make those as like interest points in my video. I'm not gonna lie, I'm not really that tech savvy. So for me to be over 2 million subscribers on YouTube, I have no idea how I got there. I just like to show what I do, and I'm just, I guess, very genuine and with what I do. But yeah, when it comes to technology, I mean, you guys see how the videos are. I'm not, it's wife and I just, iMovie edit and whatnot. So now with bringing on somebody who actually knows how to video edit, yeah, it's going to be a little bit clearer, crisper, probably a little bit more of a better viewing and watching, flowing, type video. So hopefully it'll be better for you guys. All right, let's see. Where did I go to chiropractic school? So I graduated from Life University in Marietta, Georgia. That's where I went. Okay. I'm going to do a few more questions and let's see. Then I actually have to head off to church this morning. So I'm going to be on for about 2 more minutes here. And let's see. Okay. I'm in Texas. Where's the address? I want to make an appointment. So in Texas, if you guys check out my buddy Alex Tubio, he's in Houston. Um, he'd be able to do, obviously, you guys see both him and I. He'd be able to get you real well. I'm very confident in his ability. So in Houston, he'd be the best. All right, Carlos, you also have the nicest looking clients. But well, thank you, thank you. Honestly, everyone, it's whoever walks in. It's funny when I see comments and people are like, "Oh, he tells people to wear whatever." Like, no, just that's how people walk in. Now, trust me, sometimes it baffles me. Like when I walk in, like to my reception area to get a patient and I see somebody sitting in there and I'm like, "Oh my god, what are they wearing?" And I'm just thinking that in my head. I'm like, "Oh man, you're gonna get torn apart on YouTube," is like the first thing that just jumps in my head. And then I'm like, "Well, it is what it is. I mean, I can't help what people wear or don't wear, or, lack thereof wear. But it's yeah, that's on anybody can wear whatever they want. No issue on that. But all right, let's see. Oh, can I from Blue Willow? Thank you for that super chat. Can I treat someone with a Chiari and spondylitis? I have had patients. They were depending on the type of Chiari malformation. I have had, I guess you would say, milder type cases I've helped with. That's with the spinal cord where it's kind of coming out of the basically like right here, right at the atlas is kind of like getting pulled out of the brainstem a little bit. Yeah, milder cases I have had um, actually really good work with. Spondylitis, I spondylitis, losis, listhesis, any type of spondies, no problem. I deal with those on the daily. Yeah, not an issue with that at all. All right, so let's see. All right, Carlos, favorite pizza spot. Uh, So for me, with being a Michigander, I'd say go-to is Jets Pizza for me. Can't beat that square Detroit style pizza at all. All right, let's see. All right, from Cincinnati, great chiropractic things. Love the Y-strap. Can't wait to try it. Heck yeah. Have I ever kicked a patient out of my office? I haven't, but I've gotten pretty close. I think when I had my wife in there, I think my wife has gotten quite, you know, she takes a lot of the grunt, or now if in my Tampa office, I'll have my mom in there at the reception desk, and it's funny, they'll take some grunt, a lot of the times, when you're going into an office and you're in pain, like you don't mean to be mean or snappy, but oh yeah, it can happen. And then it's like after they see me and they leave, it's like night and day difference. It's like a completely different patient walked out of the door. Okay, all right. Let's see, I'm gonna grab one more and we're gonna or I'll do two more and then we'll take off. So I gotta get headed off to church over here. Okay. Let me see. Okay, so one where you were asking was curious to what happened to that guy with super bad AS. Dude couldn't even lay on his back. I know who you're talking about, Brian. So Brian, and I felt bad because his boss actually brought him in because he was concerned about his care and like his health. And Brian, as being a single dad, I offered him actually even free care. I just wanted to help him. And I knew obviously with the videos and the views, like, you guys as viewers would love watching, that type of issue. Um, I wish the best for Brian and whatever route he wants to go. I think he got a little bit scared from other providers out there, kind of just in the back of his head of what he should do, what he shouldn't do. I know with a case like his, it was on the kind of off the deep end. It was very, very like far along. Um, I was basically with what I could do. I mean, of course, anybody with AS, you're not reversing it. It's managing to, as best as possible. And yeah, he's kind of not sure where to do or what to do, but as long as he knows, he's always got me to help him if he needs it, and hopefully he gets what he's looking for. And all right, Carlos. So what other Cairo channels do I subscribe to? Actually, I would say I watch my boy Tubio all the time. He's a great Cairo, great friend. There are actually a ton of good Kairos out there, and the one thing that I like is I like watching chiropractors who actually have real patients, not people who pick or choose or only do select style or genre. People who are actually seeing your normal, real, everyday person. That somebody like back in the day, I know Dr. Jason hasn't been posting much, but Dr. Jason was good. Even Dr. Johnson in Houston, they post real everyday patients, like Dr. Binder, um, like those are real people. Like, and that's that's what I like. Like seeing like the realness, the real people, real patients, not just because they have a certain figure or whatnot. There's a few out there that specifically only do a certain style, and they refuse patients that don't fit their what they're looking to put on YouTube. So, some people that will only get like a model looking female or a jacked up dude that, is ripped. And that's the only type of people that they do. And I mean, it is what it is. It's YouTube and that's what that's what helps them get the views. But I like my everyday people. People normal in pain. That's what I like, helping people in pain. Doesn't matter how big, how small, anything like that. But all right, guys, I wanted to say thank you, thank you, thank you. Let me know if you guys did like me doing this live because I have no problem in hopping back in. Just say like once a week or once every other week. Um, and I'll definitely go over, just kind of give a little update. So now that I've seen some of the things that you guys want me to kind of focus on or improve on, I'll definitely start working on those. And then in a week or 2 weeks, I can kind of reach out and see what you guys think and do another live. Next time, I'll try to, instead of just randomly hopping on, I'll try to actually like pre-plan everything. But all right, guys, gotta head off to church. But thank you guys. Thank you for watching, and I will see you in a little bit. Thanks for the advice, everybody.